So Med Ed here at Firelands Health is an excellent staff. It is support staff and attendings and faculty that want to teach the residents that are here because we love to be here. We want to be small enough to know you, to support you, to also give you the knowledge to leave this institution an excellent physician.
Not only am I taking skills and knowledge away from this, but just watching the leadership here, I'm learning how they function as leaders, and those are some skills that I will definitely be taking with me. There's a lot of programs where the leadership is out of touch with the people who are on the front line, and it leads to a very brittle type of culture. Here, that's not the case.
So I chose this program because of the culture. I noticed very early on during my interview process that the people who were interviewing me genuinely cared. And during my interview, I met some doctors, and when I came here, they remembered my name, which is amazing because a lot of times you're just a number and they don't remember your name. It also allows you a lot of freedom, the transitional year program, to kind of cater it to your education and what you want to do. So you have the opportunity to do elective rotations and to travel outside the system if they don't have something that you're looking for, and Med Ed just seemed so flexible and so wonderful to help you attain your goals.
There really is a very family culture around here. And I think we're really committed to making sure that people succeed.
People always say the culture is very important, but you don't fully understand that until you get to different places and compare them. And then seeing the providers that trained here and maintained their jobs here, everyone stays in this area, so there's a reason for that, and that's clearly shown when you spend time here.
It's a very loving culture, accepting culture, yeah. Love and acceptance for new residents, accommodations for new residents. This place really does prioritize your mental health, especially in a career where that's overlooked for practitioners.
Some of the benefits I think to our program are we're a little bit smaller and we're completely unopposed. The family medicine residents are the only residents within the hospital, along with the transitional year residents and then the hospice and palliative medicine fellows. You are working one-on-one with the attending, you're getting that individualized attention, you're first assist on the surgery, you're delivering the baby with a OBGYN. Like, you are the resident, you're not competing for those spots.
We all go into medicine to help people. And not only do they get an opportunity to help people while they're here at Firelands, but they also get top-notch training in the process so that when they leave here, they're ready to provide that care to their own patients. And then whether they decide to set up here or whether they go across the country, we've got graduates all over the place.
I think there's just a feeling that you get when you're in the right place, and that was apparent for me. The people here are just extremely welcoming, and they support who you want to be as a physician, and they make sure you have the opportunities available to you to become that physician.
If you want to do sports medicine, there's opportunities for that. If you want to do women's health, there's opportunities for that. And our program works to allow you to have those opportunities, so when you go into practice as an attending physician, you feel prepared to do exactly what you want to do.
And I feel very confident that the people that we've graduated move to their next program with probably the best clinical experience I think you could find anywhere.
We've seen about 1 in 4 of our graduates stay in practice, which is a very high number, especially for a community-based program.
I think here it's not just about preparing you with knowledge, it's really about preparing you as a lifelong physician, but also a lifelong learner.
I have loved living in this community, being on the shore of the Great Lakes. It's hard to describe what it's like to live along the edge of one of the Great Lakes if you haven't done it before. It's a one-of-a-kind experience.
When I speak of Firelands, it's my alma mater. It's the institution that I will always look to say, if I'm a good physician, it had a lot to do with them. And it's an honor and privilege for me to be able to come back to a residency that I graduated from all those years ago and give back.
Everyone is just so friendly and welcoming. It's a special place.